Step-by-step overview. 1. Synthesis of norepinephrine, NE, starts with tyrosine, which is converted to DOPA, then to dopamine. Dopamine enters vesicles via VMAT, vesicular monoamine transporter, and is converted into norepinephrine, NE, inside the vesicle. 2. Storage and release. When an action potential arrives, CA-quermide channels open, allowing calcium into the neuron. Calcium triggers fusion of vesicles with the membrane, releasing NE into the synaptic cleft. 3. Binding to receptors. NE binds to alpha and beta adrenoreceptors on the postsynaptic neuron, causing sympathetic effects. 4. Reuptake and termination. NE is mostly recycled by the NET, norepinephrine transporter. Some NE is degraded or diffused away. 5. Presynaptic modulation. Alpha-2, IFA-2 receptors act as autoreceptors. NE binding here inhibits further NE release, negative feedback. Angiotensin II, A2, can stimulate NE release, positive feedback. Drugs and their actions. Noradrenergic stimulants, amphetamines, and ephedrine, enter through NET, displace NE from vesicles via VMAT, and reverse NET, causing NE to be released into the cleft. SNRIs, cocaine, TCAs, MDMA, block NET, preventing reuptake, increase NE in the cleft. VMAT inhibitor. Tetrabenazine inhibits VMAT, less NE enters vesicles, reduced NE release. USMLE questions. 3. Question 1. A 24-year-old man presents with agitation, dilated pupils, hypertension, and tachycardia after taking an unknown stimulant. Lab results suggest increased norepinephrine in the synaptic cleft. Which of the following mechanisms best explains this drug's effect? A. Inhibition of tyrosine hydroxylase. B. Activation of alpha-2 autoreceptors. C. Blockade of norepinephrine transporter. D. Activation of muscarinic receptors E. Inhibition of monoamine oxidase B. Correct answer C. Blockade of norepinephrine transporter, NET. Explanation. Drugs like cocaine and TCAs block NET, preventing NE reuptake, resulting in increased NE in the synapse, causing sympathomimetic effects. A. Would reduce NE synthesis. B. Would inhibit NE release, wrong direction. D. Muscarinic receptors are cholinergic. E. MAOB mainly affects dopamine, not NE. Question 2. Which of the following best explains how amphetamines increase norepinephrine availability in the synaptic cleft? A. Stimulating tyrosine hydroxylase activity. B. Activating postsynaptic beta-2 receptors. C. Enhancing NET reuptake. D. Displacing NE from vesicles and reversing NET. E. Blocking alpha-1 receptors. Displacing NE from vesicles and reversing NET. Explanation. Amphetamines enter the presynaptic terminal via NET, use VMAT to enter vesicles, displace NE, and cause reverse transport of NE into the synapse. A. Increases NE synthesis but not immediate release. B. This is an effect, not a mechanism. C. Amphetamines reduce, not enhance, reuptake. E. Alpha-1 blockade would reduce sympathetic tone. Question 3. Tetrabenazine is prescribed to a patient with Huntington disease to manage chorea. What is its most likely mechanism of action? A. Inhibits monoamine oxidase. A. Enhances dopamine reuptake. C. Inhibits VMAT, reducing NE and dopamine release. D. Stimulates alpha-1 adrenoreceptors. E. Blocks NET, increasing synaptic NE. Correct answer C. Inhibits VMAT, reducing NE and dopamine release. Explanation. Tetrabenazine blocks VMAT, reducing the storage of dopamine and NE in vesicles. This leads to less release of these neurotransmitters, reducing hyperactivity, like chorea. A. MAO inhibitors increase, not decrease, monoamines. B. Would increase dopamine, worsening chorea. D. Would increase sympathetic tone. E. NET blockade increases NE, opposite effect,